I am so impressed that everybody showed up tonight after that superstorm. I had an inspiration knowing that there were going to be this many people. I left Montreal at our place in the Laurentians at 5 in the morning. When Poiliev is talking about the Laurentian elite, he's talking about me because I actually live in the Laurentians. The day before yesterday, Ontario introduced Bill 60. Now, you'll never know it by reading the title or anything in it because it all talks about integrated community health care. Good luck trying to find the word private in there anywhere. But we all know that that's where this is headed. So let's look a little bit at the history of how we came to our present system and what needs to be done to make the system much better for the future and for our kids. All three major political parties can claim some ownership of that system. That Christy correctly said, we've always liked to compare ourselves to the Americans. But now we've got to start looking at ourselves and what we're actually delivering, because the only thing that matters is results. All the rest is debate. We like debate, but we like results even more. We learned that during the pandemic, whether it was the Heron residence, where dozens of seniors who were in a private care home were left to die in their excrement, dehydrated. The same thing happened in Bobcaygeon. The Army had to be brought in. This was private care. But there was no enforcement because they had actually here reduced the number of people enforcing it. So I don't want to abuse, but I will say this, that when Christy says that when you have somebody who gets an infection and they have to go back to the hospital, if they've been in private care and the private care has received the money from the government, guess what? If they develop an infection, they're right back to the public system. So this has to be based on evidence, it has to be done step by step, and it has to be done, dare I say, the same way the first system was, with every single political party taking some credit for what has to be done to make it better. I'm going to concentrate on a study that was done at Oxford and published in The Lancet last June. We're talking about having evidence-based decision-making. I'm going to read from it. Private sector outsourcing corresponded with significantly increased rates of treatable mortality. That's not an opinion. That's The Lancet. That's Oxford. And it's not untrue that the system in France was built up differently, the same way the largest pharmacare program in Canada, which is in Quebec, was built up to include a hybrid model. But it's not true that there are not problems with the French system. There are huge problems with it because, as Dr. Martin correctly pointed out before, there are huge strikes going on, and it's not in one or the other, it's in both at the same time because the system itself has huge problems as well. So it's interesting. The comparative method is a good way to get information, but that's the information that informs the decision-making process. But what I've seen here with Bill 60 is you come in with the result and then you're trying to backfill to explain why that result, more privatization, was the right decision instead of doing it the other way around. We're putting the cart before the horse. You know, when you've spent a long time in government and in politics, you come to these grand realizations. I'm about to share a couple of them with you. Tony Blair once said to me, in public administration, there are only two things. There's that which works and that which doesn't work. Now, of course, I remember using that anecdote with some of my colleagues in the NDP, and they immediately tagged me as a Blairite, and it really hurt my reputation with my colleagues. But I do think that Tony Blair is a good model of public administration. So I have to say that I am in violent agreement with Christy Clark when she says a lot more could be done in terms of public administration. Now, she says they have hundreds of thousands of bureaucrats in BC. If that's the case, they should start working on it right away. But across the country, anybody who knows anything about public administration can tell you that there are better models that can be used, there are economies that can be had, more competition. But when we say competition, isn't that just a way to bring in more private care? So, you know, Bill 60 and Keep 40 is probably the full title of the legislation that was brought in the day before yesterday.